Well, drugs to help with diabetes like Wegovy were recently approved by the FDA to help with weight loss. Now they're being looked at to help with other health issues as well. Dr. Angela Tran woke up early to join us this morning.
Happy Sunday.
So good to see you as always.
Good to see you.
Okay, I mean, this is making headlines, but for folks who maybe are not totally caught up with what's happening with it, what's going on with Wegovy?
Yes, major breaking news. So Wegovy is one of the newer FDA-approved medications for weight loss, but now the drug makers released a report that not only does it help you lose weight by 15%, now it can potentially reduce heart disease by 20%.
Wow.
Yes.
And how closely has this been studied? What do we know about that?
You know, over 17,000 patients has been in this clinical trial. So the studies are significant. They're still early reports, but this is exciting because this is really the only medication on the market right now that can do both weight loss and heart disease prevention.
And what is it doing regarding to heart disease for folks?
It helps with lowering your risk factors. So as you know, the common risk factors are high blood pressure, high cholesterol, being overweight, and diabetes. But I want patients to understand this can be silent, meaning you may not have symptoms.
Right.
So it's important to see your doctor because you might want to catch it before it's too late.
Yeah. Can you talk about, one thing I've been curious about a long time is like, okay, you go on a medication like Wegovy, do you stay on it for the rest of your life? What happens if you go off of it?
Very good question. So it's actually a two-answer. What happens is that some patients actually can take it long-term. They've been struggling with, diabetes, heart disease, weight problems for a long time. But I always encourage patients, you're not meant to be on any medication forever.
Right.
There is an opportunity to learn the right healthy habits so you can do this in a long-term healthy lifestyle.
And would you be able to maintain whatever weight loss you had or improvements with heart disease? Would you be able to maintain that off of the medication?
Absolutely. As a medical weight loss doctor, it's always important about the mechanics, which I call nutrition, diet, metabolics. Then it's all about movement, which is exercise, but then mindset. It's all about the right behaviors, time management, working on your stress, things like that.
Got it. Accessibility is a big deal here. What are you hearing about? Can you find it? Is insurance covering this?
Yeah, Wegovy is a very popular medication. It is in an injection form once a week, so they do have some national shortage challenges. However, they are coming with a pill version coming, so that's going to be exciting. Nowadays, insurances, some do cover it, some don't, but hopefully with this new study, it's going to be a game changer, especially because we want to do, prevention as part of our healthcare.
There's so many names kind of circulating right now, so how is this one different from like Ozempic or things like that?
Yeah, the funny thing is Wegovy and Ozempic is actually the exact same medication. They fall under the generic name semaglutide. But Wegovy, people need to understand it's FDA approved for weight loss. Ozempic is actually FDA approved for diabetes. So you need to work with a medical provider so you can understand if you're a candidate for it.
Right. You got to make sure that you're using it the right way. And I know we have talked about making sure that you're also not finding, an alternative or something that is similar to it that's not FDA approved.
Yes. And as we know, medications are great tools. However, prevention is the prescription of choice.
All right. Well, thank you so much. It's so good to have you, and we appreciate it.